So we today are going to go through a process. And the goal of today is really twofold. What we want to do is identify a few priorities that we can focus on to improve the health of Skokie. Second is we want to make sure that people understand kind of the basics of the collective impact approach. And the third is to conduct what we call a factor analysis around those priorities that we identify. I want to start by demystifying what collective impact is. It's not some kind of scientific model for doing something in an abstract way. It's a set of best practices that effective coalitions have always used. And you can go back and back map, which we have past coalitions who've moved population and systems change into communities or nationally, and you'll find they have these same elements in place. The way that I came to this work was back in 2010. I was part of something called the White House Council on Community Solutions, which was part of the President's Domestic Policy Council. And we were charged with finding how are communities solving problems. And what first kind of came to us was lots of people with a focus on how do we find the best programs and scale them? How do we find something that works and scale it to as many communities as possible? And that makes a certain amount of sense, but something was gnawing at me about it. And it really hit me in April of 2010. That morning, as was mentioned, I'm from Milwaukee. The headline of the local newspaper that morning is we had the worst reading scores for African American children in the country. That same afternoon, I got a newsletter from the largest youth organization in the city boasting about all the outcomes it was achieving with the 15,000 children they serve. And that disconnect really hit me. And I was thinking about, my kids have been in those programs. I know those programs. I know they're all measuring outcomes and reporting outcomes to their community foundations, the United Way, to others. I'm like, how can we have all these programs doing good work, creating outcomes, but when you add it all up, we're getting this? And so I went back to the council and suggested, what about instead of looking for a great program that works with 50 people and trying to scale it to more communities, is there a community that's achieved scale in terms of solving a problem in that community? Is there a community where third grade reading scores have risen 20 points or violence is down in half? Where communities have moved a needle? And we began this exploration, and right as we began this exploration, this article came out in the Stanford Social Innovation Review called Collective Impact. And the important thing here is they didn't invent it. They were describing something they found, and they used 3 examples of 3 communities that had moved to population level change, and they found these same kind of elements involved with how they did it. And with our White House Council, we looked at 22 cities that had moved to population level measure by 10 points or more. And we found the exact same things that John and Mark found in their article called Collective Impact. And one of those communities happened to be my home community, Milwaukee, and it was our United Way and our city health department had taken on the issue of teen pregnancy starting in 2006. Again, 6 years before there was something called Collective Impact. But they hit the same problem. Milwaukee for 20 years had been number 1 or number 2 in the country in teen pregnancy. Great, I'm doing another great ad for Milwaukee. And in 2006, the rate was 2.5 times the national average. Let's process that for a second. We were 2.5 times the national average. I mean, off the charts. And there were lots of programs getting funding every year to work on it. They're all reporting outcomes back. And people are like, something's missing. So they brought together a summit of everyone who worked on the issue. And as they began to do that, they started looking at mapping what they were doing and understand. But what they came to was an agreement that there were 3 strategies that they would do at scale and get everyone coordinated and organizing around those 3 strategies together in order to try and move that needle. And the results of that work over the next 8 years was they reduced it by over 70%. They went from 2.5 times national average to below national average over a 10-year period. And I want to emphasize the 10-year period piece because this is now year 15 and they're still working on it. So the other thing about collective, it's not something you say in 2 years we're going to increase reading scores by 80%. That's not going to happen. But over time, they were able to move the needle, and we've seen that happen in a number of communities where they've been able to approach an issue, build strategies, organize all the folks who can work on it together, and actually move a needle. So it's not just about program outcomes. We have a couple of great programs that have great outcomes. We have actual communities that are working. So the way we define collective impact is that it's a network of community members, organizations, institutions that advance equity by learning together, aligning, and integrating their action to achieve population and systems change. Let me just break that down for a moment. The focus of collective impact is to create population and system change. It's not let's work better together or combine what we're already doing. It's about trying to move a community level needle. And it's really trying to aim at something bigger. The reason why we have equity in the center of the definition is because you can't move population change if there are inequitable results in your community. And so if disparities are large between different subgroups in your population, typically by race, but sometimes by gender and other areas, you can't move the needle unless you're addressing the disparities within the populations. And so you have to focus on equity in order to move population change. And the work is, again, learning, aligning, and integrating work. It's not about let's report on what we're already doing. It's about figuring out how we do it together and how we learn from each other and how we integrate and how we align our work with each other to make that happen. When I use that example, a lot of those programs still existed, but they weren't just doing whatever program they were doing before. They were all doing these three strategies. And that's the shift. Organizations had to change what they do to align to the common agenda they'd all created together. It wasn't some force above telling them to do this. They had all agreed these are the strategies we need to move the needle. There are 5 elements that we typically think of with collective impact. The first is a common agenda, which we're going to talk about in a moment, which is a results-based strategy that's at the scale and complexity needed to solve the problem, to move the needle. Once you have that agenda, you have to be able to measure how we're doing in real time and adjust and do that so you can look and say, hey, we're noticing births are increasing still in these 2 zip codes, so we need to put more resources in these 2 zip codes. Or we're working on 3rd grade reading where like 9 of our schools are making improvements, but 3 are still behind. We need to get more mentors over there. That we're sharing data not to write reports at the end of the year about how we're doing, but to manage in real time and coordinate our work across organizations in real time. The third is that we're figuring out how to connect dots among organizations and groups. So we sometimes have multiple organizations serving the same neighborhood, if not the same families. And how do we actually operate as a system? How do we operate in an integrated way on behalf of the people we're serving? The fourth is continuous communication engagement. To do this, we have to have a process that brings us together and helps us continually communicate and work together. And finally, there's a backbone staff whose job is to facilitate and support the collaborative. And that backbone is really, again, key because one of the things that I think Collective Impact recognizes, lots of us have been part of partnerships and collaborations. If there's not someone there facilitating, project managing, holding people accountable, coordinating, it often falls apart because we often have so much on our plates. So, what's different about collective impact when we think of it in terms of other kinds of collaboration? The one is the first thing I talk about. It's aimed at population or systems change. It's not aimed at my program having better outcomes. It's aimed at how do we improve these health outcomes at the community level? How do we decrease infant mortality in the community or decrease teen pregnancy or increase reading scores or graduation rates? It's about moving at a population level, not at an organizational level. The second thing is that it takes distributed leadership. It's not about one organization doing this, and the backbone is not the CEO of the collective impact. The backbone is the facilitator, coordinator, support behind groups doing this work together. And so the leadership to move this has to be distributed. It has to be lots of people who own it. That I might work at an agency and I might say, you know, at this agency, part of my work is working on this community-wide initiative, right? Like that I see my work as being part of it. The third is, again, that the partners own and implement the strategies, which is part of that distributed leadership, that it's not about we've created an entity to do something. We've created an entity that's coordinating us to organize our work around moving a strategy together. We don't go to meetings to report on our activities. We go to meetings, again, to coordinate our work with each other to move the outcomes we've agreed to move together. And finally, it's both data-driven and community engaged. That to do this work well, we have to be data-driven, but data has to be interpreted. And we need to make sure that we're interpreting it through the perspectives and lives of the people who the data is about. And too often what we do is we treat data as something over here and community engagement as something over here, and to us, they have to be married for this work to be effective. And so those are some of the things that are different about collective impact. Another thing that we mentioned at the center was racial equity as being a really key component of this work. And to us, we define equity as fairness and justice achieved through systematically assessing disparities in opportunities, outcomes, and representation, and redressing those through targeted actions. And there's 5 things we look at the Collective Impact Forum as things that groups do to center equity in the work from the beginning. One is grounding the work in data and context and targeting solutions at disparities. Again, at the center of a definition is the reality that if we're trying to move population change, we need to make sure that population change is moving for all populations and not just for some, and that we're reducing disparities in the mix. The second is often we have to focus on systems change along with programs and services, that there's often systemic barriers that are preventing our equity within the system. The third is we need to shift power, that the voices that are heard, the voices that are driving the work need to often shift in a collective to be more equity. We need to listen and act with community, and we need to make sure that people have, that the organization, that the effort has accountability on its equity commitments. So the 3 things that we found that make the biggest difference in collective impact success, there's 3 best practices that in doing this work and visiting with hundreds of groups, I've learned over time. The first is that the clearer the strategy, the better the commitment. And I'll talk more about what that looks like in a moment, but to use a simple example, if I set a goal for my community that our goal is that all children read at grade level, and then what happens is people come to meetings and report on all the work they're doing to help people read. If instead we say currently there are 500 kids in our community who are reading at grade level each year on average, and about 200 are not, and those 200 are primarily in 4 schools, then our strategy is going to be figuring out how do we actually focus or emphasize work within those 4 schools to move that number of kids, and we're measuring against that metric. And the commitment of people, because their clarity about what's needed to move the needle is much clearer, which keeps people more committed to the effort. When it's vague or aspirational or it's unclear, then it becomes a place where people report on what they're already doing. And it becomes a meeting I might go to or might not go to. When I know that meeting is dictating what I'm doing back at my agency for the next month, I'm at that meeting. Because I don't want decisions to be made about what I'm going to be doing that I'm not part of, right? And so the clearer and more precise the strategy, the easier it is to keep a group committed to it. The second is that the forum has to follow the function. That too often what we see is people try to form the collaborative and then decide what the strategy is. Our view is you create the strategy and then determine how do we best organize the community around doing that strategy. What action teams or work groups do we need? What kinds of people need to be on the steering committee to govern this strategy? What people need to be in what parts of that effort? And so when we have a clear strategy, that really helps us determine who needs to be in which seats in order for that to happen. So the form of the collective impact has to follow from the function, the strategy. And then finally, culture eats strategy for breakfast. When I did that activity at the beginning and asked you all about what doesn't work, that's all about culture. That was all about culture. And so often we get so focused on the technical. Let's make sure we have this and this and this, and what we forget is this work's relational. It requires trust. It requires inclusion. It requires accountability. It requires shared learning. That if we don't create a space that produces those things, we could have a great strategy, but it'll fall apart. And I joke to say that most of my job is doing collective impact repair, and about probably 2/3 of the groups that I'm dealing with, culture has fallen apart. And it's because they never paid attention to it. They didn't realize that you have to intentionally build it. It doesn't just happen. That leaders and groups have to create a culture that supports the kind of inclusion, the kind of collaboration, the kind of accountability necessary to move the work forward. So I'm going to take this first part about strategy and dig in a little bit more there, because that's kind of where we're starting our work today. And the way we think of building a common agenda starts with the idea that In most groups, the way that kind of logic models, their theories of change and things happen is that someone has a program, they have a set of outcomes, and they imagine that if at some level there's other programs in the community working on similar outcomes, and if we grow our outcomes and add it to others' outcomes, that voila, will create population change. Except for it never happens. We end up with lots of programs with outcomes, but we're not seeing that shift. It's a magic wand between often the activities and the population change. The way that we approach building a common agenda starts with the idea that we have a clear result and an indicator and a population. So I'm going to use an example from another city around infant mortality. So in this community, they had a very high rate of infant mortality, and their result was to reduce infant mortality over a 10-year period by 20%. Their indicator, of course, was the infant mortality rate. Their population was city, and that city was, let's say, about 500,000 people. And so they defined the community, they defined where and what period of time. Then you have to do that racial equity analysis, that equity analysis to disaggregate the data and understand where different populations are relative to our goal. So in this case, in that community, the African American rate was double the white rate. The Latino rate was almost in parity with the white rate. So they realized there was a racial disparity, so they actually set a goal to actually decrease the African American rate by more than 30% while they're trying to decrease the overall rate. They also recognized that the problem was predominantly in 6 zip codes where there were about 15,000 women of childbearing age. And so the focus population is going to be these 15,000 women of childbearing age where there's about 1,200 live births in these 6 zip codes. And so while their goal is citywide, they've disaggregated data and built an equity analysis to determine what populations need to move the overall. Then we have to understand what are the factors that support or impede our result. And we have to first brainstorm, and then we have to test and confirm them. We have to look at what does research say, what do things tell us. And one of the interesting things in this case was that, and it was my first time working on this issue, is most of the groups in the room that were working on this issue were working on safe sleep, which is an important thing. But when they looked at the data together, which you'll do too, on this issue, because they were focused on one issue, 60% of the mortality was a result of prematurity, about 25% birth defects, about 50% happened in the home. And they realized that all the effort was being driven at 15% of the problem. And if you're trying to reduce it by 20 or 30%, you're not going to get it by focusing only on 15% of the problem, right? And so they realized they had to do a factor analysis around prematurity and understand what are the factors that drive prematurity. Then they had to take all those factors once they've tested them and researched them and used data to kind of confirm them and prioritize which are the ones that we think we could have the most impact on, that would have the most impact on moving that needle. So first they identified which of these factors have the best chance at moving that result, and then which of those factors do we think we could have the biggest chance on moving. And those became the highest priority. And they, again, you have kind of a portfolio of strategies. There were some strategies that were heavier lifts than others, but there were a core set of strategies that they recognized these are the things we could have the most impact on that could impact that. Then for every strategy, and forgive, I don't know what's happening with the screen here, disco screen or something. I feel actually I have electronic music in the background. We have to have performance measures that tell us how much of that strategy do we need, how will we know it's working well, and how do we know that it's making a difference in our intended outcome, in our intended population. So one of the strategies they chose was one of the factors they identified as if, I believe, is if a woman gets pregnant within a year of giving birth, she has a higher chance of delivering prematurely. So they wanted to increase spacing was one of the things they wanted to do. And so one of the ways to do this was this evidence-based program they found in Boston that like meets with mothers of newborns and has this conversation. And so they decided that would be one of their strategies. Then the question was, how many mothers are we going to reach a year? How do we follow up to see if that conversation had any impact? And are we seeing any shift in spacing, which we know then will contribute to ultimately that change in prematurity and infant mortality? So our strategy, a strategy is a strategy when we know how much, how well, and what difference. Until we can answer those 3 questions, it's just an activity. Then once we know all that, then we figure out who's all needed to implement that strategy. who's all needed in what places and groups in order to do that. Just a couple examples here, just to kind of give you illustration of it. The first comes from a community that was working on affordable housing. In their case, in their community, they had their population analysis told them there were about almost 60,000 rental households in the region, and over half are rent burdened. And rent burden is when people are paying more than a third of their income in rent. And they realized there was a massive gap in need of development of affordable housing. It was one of the factors they came up with. They set their goal was a 30% reduction in rent burden population, which means helping 10,000 families. They developed a set of strategies. I'm only including one example of a strategy, but the strategy was to build and sustain a regional pipeline of community valued projects that will generate at least 1,000 units a year. At this point in this region, there were 9 cities in this region. The 9 cities collectively from 2008 to 2018 built 360 units of affordable housing, or about 36 units a year. And they realized they had to dramatically scale that in order to address this problem, because at that level it would take like 500 years for them to have enough housing. So they needed to move it from an average of 36 to 1,000. They developed a strategy. They figured out how much, from 36 to 1,000, how well the units would meet criteria established by the community resident council that established what would quality and appropriate housing be, what is it that the residents are looking for, and then the new affordable housing. Now, that sounds simple. They have a whole financial structure around that and a whole very innovative way of doing that through a public-private financing mechanism and a community-wide pipeline. But the idea, again, is in building the strategy, you've got to define those 3 things. I used an infant mortality example already. Then another example from a school example is they wanted to double the number of students who graduate college and career ready from 37 to 74%. This state has a measure of what college and career ready means. And in this city, they were only 37% of their high school graduates were meeting it. And they wanted to double that over their period. That means increasing from 1,100 to 2,200 kids a year. Again, always break down percentages and understand how many people are we talking about. Because sometimes we use percentages to mask it. And we got to know, am I trying to intervene with 500 people or 5,000 people? What's the number? They figured out there were 7 priority high schools they needed to focus on. They had a strategy, and one of their strategies, again, I just used one sample. Each of these groups have multiple strategies. But one strategy was expand the early post-secondary opportunities, those EPSO courses like AP and others, and how much every school have at least 5 of the high demand. They found when they did their analysis that some of the schools in the wealthier parts of the city had the EPSO classes that were geared towards better careers, and the ones in the lower income communities had the kind of less ladder-like EPSO courses. So they want to make sure that 5 of what they identified were the high-value ones were in every single school, and that every single student will complete at least 2 of them, and at least 2/3 of those who participate are people of color because of the disparity in the racial group. They would track post-secondary credits earned from those as a way to see that that's making a difference, and increasing the number of students getting credits at the schools where they enroll. So just again, giving you that illustration of what that looks like. So the second piece is form follows function. And just quickly, the way a collective impact looks is there's typically, again, there's work groups that are built around any one or more strategies. And there's a steering committee that governs the effort. And the steering committee typically includes the chair or chairs of each of the work groups, and then other leaders who have either influence at the level of being able to move institutions or influence at the level of having credibility with important stakeholders. And they govern the common agenda that's made by the whole group. The group creates action teams or work groups around implementing strategies. And the backbone staff's job is to facilitate and coordinate across all of that. And so again, you don't know coming into a collective impact who should be on the steering committee, who should be in the work groups until you actually build a common agenda. And typically what a group does is bring some kind of representative group of leaders together that's diverse and brings different perspectives to kind of figure out what that agenda should be. And then once we have that agenda, then we figure out how to organize around that. And a couple things to just note. One is that each collective impact looks different. All of them based on the result, the strategies, community context. In Milwaukee, we have a Cradle to Career Education Collective Impact that has 9 full-time backbone staff and I think 7 work groups. We have a mental health one that's geared at children that has 1.5 FTEs on the backbone and has 3 work groups. We have an arts one that has a 6 full-time staff backbone and has 4 work groups. Again, every collective impact looks different based on the size of the community, the work they're doing, and again, what's needed. There's not one right way. People say, what's the right size? I'm like, what's the right size for your student? It depends on the size of the community, the issue you're trying to do, and who you need around the table to solve the problem. The second, again, is you build tables around strategies, not strategies around tables. I was in a committee earlier this week where they focused so much on trying to keep everyone at the table that they watered down their strategy so that everybody could feel included. But then when they did that, what happened is they ended up not getting anything done because they were so worried about it. Well, if we don't have this activity in our strategy, then we lose this partner. But the activity wasn't at all strategic to moving any result. But then they got bogged down in all these activities instead of completing a strategy. And so again, the idea of the collective impact is you build the forum around the strategy, not the other way. Think inclusively about who can contribute to results. My favorite example of this is in Southwest Wisconsin. A lot of people know in America right now, the farmer suicide rate is double the veteran suicide rate. It's the highest group for suicides in the country. And in Southwest Wisconsin, it's been particularly acute. And their community action program was trying to organize around working with this population. But what they found is that the population of farmers who were trying to reach were distrustful of social services. They tended to be very self-reliant and stoic. And they tended not to be very supportive of wanting to talk to institutions. So what they did is they started mapping who has relationships with the people we're trying to reach. And they worked to build relationships to figure that out. And they found out the extension was a trusted place. They found out seed dealers and feed dealers and mechanics and equipment implementers. And what they did is they started going to those places, inviting them to their table. And then what they did is they started figuring out how to do mental health first aid training with people in the professions that work with farmers. But first they did this process of trying to change the language around it. But the point being is if they came together and said, let's bring all the people who work on mental health together to work with this population, it wasn't the right population. So we have to, again, look at what we're trying to do and ask, who are the people who can best help deliver these outcomes? And think out of the box where we can and think of community in a different way. And finally, the idea that, again, that partners work back at their agency should be based on the common agenda. That it's not a committee I go to for something else. It's a place I go to work on the work that I'll be doing back at my agency. I'm at that table because it's important to the work I do. That I work with kids and I want to make sure that our kids are achieving that result. And so I'm at that table because I want to make sure that the reading programs and my after-school program are coordinated with what we're doing in the schools so that we're helping move and be part of this effort to increase grade level reading in this community. And finally, culture eats strategy for breakfast. And just, we tend to think of culture as the way you build a set of leadership values that can drive distributed leadership and help people work together. And I wrote a book a few years ago based on, I spent 20 years leading a group called Public Allies nationally, and we did a lot of leadership development in communities across the country. And we came to a definition of leadership that I found very helpful to collective impact. And it's based on the idea that when I say everyone leads, it doesn't mean everyone leads at the same time. What it means is leadership's like a muscle. And like every other muscle in your body, it only gets stronger with exercise and practice, right? Like we all have that muscle. And the important thing is to recognize everyone has it. And the goal of any community or group is how do we build collective leadership muscle? And the way we think about leadership is first that the idea of it is an action people do, not a position people hold. That we think of leadership as an action versus position really opens up the possibility of how we can think about it in a distributed way. But then if you think about what that action is, it's an act of responsibility. It's someone stepping up and owning a result. I'm willing to do what it takes to make this happen, to get this done. But then if you think about the leaders you most admire or those you don't, or the ones you love being on teams with or don't, or the best or worst boss you ever had, it's about values. What are the values that make it possible for someone to work well together? And there's 5 that we tend to focus on in this work that we found are helpful. The first is being asset-based, to really understand the community as a partner in the effort. and to think of community and to think of the assets in community beyond. That's what that group in Southwest Wisconsin did. They didn't just think of agencies, they started thinking about what are the other assets in our community, who's trusted, and ask questions that were outside of the typical question of who does that service. Think about who's trusted, who's engaged, who do people know and go to. The second is equity inclusion. I talked earlier about what that means in the context of collective impact. The third is trust, which I'm going to come back to. Learning, because we have to create an environment where people can learn together to do this work. If we all had this down, we don't need a collective impact. We have to come to the table recognizing that none of us can do this alone, and none of us are doing this well enough to solve the problem. And finally, there has to be accountability. There has to be a way that we're accountable both to each other for the commitments needed to move the work and for the ultimate result we're trying to move. And I just want to take a moment to talk about trust, because it's the essential element, and this is the last slide of this presentation. The ways we build trust in a collective, which is fundamental to building the culture, is first you have to build relationships. We have to get to know each other as people. It can't be just name, title, organization every meeting, because if you got the grant I was supposed to get last year, I hate you, right? But like, we have to know, the moment we get to know each other as people, it opens up the possibility of us working better together. Collaboration doesn't happen between institutions, it happens between people. The second is that we have to clarify the roles, responsibilities, and expectations of the group. Brene Brown always has a comment that clarity is kindness, but it's the idea that if we all agree on what we're expected to do, then we can be held accountable to it. And part of what builds trust is reliability, and we have to know what we're being held reliable to. The third is defining shared values and ground rules for the group. And again, if we can identify and create together, one activity we often do with groups is we create that list you all created at the beginning, and then we ask people to go back and say, what are 3 ground rules that would prevent that list from happening? And we use that to start building a sense of what's the culture we want to build together to prevent all the stuff we know doesn't work. We make sure we facilitate intentional, transparent, fair meetings. There can't be a meeting before the meeting that's the real meeting, because that'll kill the group faster than anything else. There can't be a sense that some people get information, others don't. You have to create a place where there's an honest brokering. We have to be able to name and negotiate interests. Again, we might have situations, I was working with a community the other day where, just yesterday actually, where like, there are multiple groups in that room who compete often for grants. And what we're trying to do is build enough trust in that group to have that conversation in the room. And so what usually happens is it all happens in the parking lot. And what we're trying to do is build enough trust that conversation can enter the room. And where we can talk about, so what are people's commitments if they do or don't get the grant, and start to have these difficult conversations in the room, which also means surfacing elephants. And finally, we celebrate. That efforts work well when there's a sense that as people contribute, as people get things done, we create rituals of celebration that make a culture and make people feel valued for what they do, because that helps build trust in a community as well. So if we think of this work as building clear strategy, as building a forum around that clear strategy, and then building a culture as you do that that supports ways that are equitable, that are inclusive, that are trustworthy, accountable, that's what we think helps make this work happen.